Hello, this is Dr. Riaz with another episode of Be Smart, Fight Strong series of videos. And in today's video, our topic is how to manage the mouth inflammation and mouth ulcers that happen when patients are getting chemotherapy. Be sure to watch my other videos. There's a lot of educational stuff, so visit my online video library www.onlineoncology.com. You will find a lot of educational stuff with a lot of actionable tips and tricks that you can apply to make your cancer journey a bit easier. So let's dive into today's topic. So the mouth inflammation or mouth ulcers is a common side effect to several different chemotherapies, and more than 50% of the patients who are getting chemotherapy will experience this problem. Now this is a huge problem because it limits your ability to eat food. It is painful. It decreases your quality of life. It can also interfere with your nutrition. What are the tips that you can apply to decrease the risk of developing this at first place? And if you do develop this, then how you can increase the healing ability of your body. Now, the first tip that I want to share with you is maintain a good oral hygiene. Now, let me elaborate this a little bit further. Now, it is a good practice to keep a good oral hygiene, and brushing teeth at least twice a day. Morning and evening is a good habit, but when you are getting chemotherapies, you will have to do a little bit more than that. That means that before even starting chemotherapy, if you have cavities or some gum disease or some other teeth problem, you may want to visit with your dentist and get your oral health optimized even before starting chemotherapy. Once you have started chemotherapy, then be very proactive in your oral hygiene. So meaning that you are at least brushing and cleaning your mouth 3 times a day. Similarly, make it a habit to use a mouthwash. Ideally, non-alcoholic antiseptic mouthwash is the best, because usually the alcoholic mouthwash may give you a very unpleasant feeling in the mouth. It may hurt your mouth. It is also a good habit to examine your mouth twice a day in the mirror, and you should be looking at ulcers in the mouth, and most importantly, if there are any white patches on your palate, at the back of your throat, or on your gums, or on your tongue, then be sure to bring this to the attention of your doctor, because the white patches can be a sign of a fungal infection, and for that you will need a prescription antifungal medicines to treat that, and this can be a very painful condition. Therefore, examining the mouth at least twice a day is a very good habit. My next tip would be that use a soft toothbrush. You don't want to use a hard toothbrush, because your mouth is already very raw, and you don't want to traumatize it any further. My next tip would be about the foods that you can take during the time when your mouth is not in its best shape. So foods like porridge, jello, bananas, pureed food is actually good compared to taking the hard food like like potato chips. They can be hard, and any crispy food can traumatize your mouth further. Therefore, taking a soft pureed food is the best idea when you are struggling with inflammation in the mouth and ulcers in the mouth. Similarly, try to completely avoid any exposure to tobacco, whether it's smoking or dipping. Also, complete abstinence from alcohol is very important during that time to help the healing process. The next tip that I want to share with you are the signs and symptoms in which you should be calling your doctor. Because mouth inflammation and mouth ulcers can be so unpleasant and can limit your ability to eat and drink, that you can very easily get malnourished, and you can also get dehydrated very easily. So be mindful that some of the conditions in which you really want to call your doctor is extreme redness or extreme tenderness in the pain. As I mentioned earlier, if you see the white patches on the tongue and on your palate or on your gums, if you have inability to eat or drink anything for more than 24 hours, because you're going to get malnourished very fast and you're going to get dehydrated very fast. So to counter that, your doctor may want to give you some IV hydration or recommend you some other medicines to help you heal faster. Similarly, if you develop any fever, that's another big red flag when you may want to call your doctor. So that's all I have on today's topic. Be sure to send me any questions that you might have at ask@onlineoncology.com. I'll see you soon with another video. Thank you very much.